This is Schizotypal Personality Disorder 101, and I'm going to give you a brief overview of what you need to know about STPD. And my presentation will start right about now. So, 3% of the entire population has STPD. Around 40% of STPD patients have depression, and above 50% of all STPD patients are male. There are many symptoms to STPD, but a patient needs to display at least 5 to be diagnosed. The few of the most common STD symptoms include unusual preoccupations and fear, where the patient exhibits constant fear of being monitored and appear very disturbed, similar to schizophrenia. Eccentric behavior, where patients exhibit unusual mannerisms. Isolation, or having no close relationships, is also common as patients have difficulty building relationships with others as they have less confidence and try to avoid possible criticism, leading to isolation. Inappropriate display of feelings also leads to incorrect interpretations of casual incidents.
Credit card? ID? I'm so freaking pissed!
And odd beliefs, where patients are superstitious or preoccupied with the paranormal. Schizophrenia and STPD are similar, however they are not the same. Schizophrenia patients exhibit hallucinations, disconnection to reality, and intense psychosis. Schizoid and schizotypal can also be mixed up as they too display similar symptoms. However, the biggest difference is schizoid patients are unable to experience emotion, while STPD patients have difficulty understanding human motivation and communication. Psychologists are unsure about the source, but they do believe STPD is genetic, as patients with STPD also have family history of STPD or schizophrenia-like disorders. Thus, parents with STPD are more likely to pass it down to offspring. Another plausible cause is social factors such as interaction between parents and child. Parents who are emotionally distant display confusing parental communication and often humiliate the child, thus increasing the likelihood of the child acquiring STPD. STPD will typically decrease in intensity with age, with many people experiencing few of the most extreme symptoms by the time they are in their 40s or 50s. Adolescents have a tendency to be isolated from others, develop poor peer relationships, increase social anxiety, and are underachieved. As they grow older, they become more sensitive to criticism or correction, develop weird use of language, have odd thoughts, and develop bizarre fantasies. This leads to an increase in criticism and disapproval by peers, thus strengthening the symptoms. So a way to remember what the disorder STPD symptoms are is using PLEASE, like please help. So the P represents paranoid, L represents lack of relationships, E for eccentric, A for abnormal behavior, S for superstitious, and E for emotionally inexpressive. However, the emotionally inexpressiveness is actually due to isolation.